come is having hypertension. A young girl who is 20, 25 come is having hypertension. The drug you write for two of them will not be the same. When you can't do 25 years, you are concerned about the fertility. When you are any drug that will affect ovulation or that axis, you will stop it. But the other woman who is 80 has entered menopause. So you are really not concerned about whatever happened in that axis. Always in your GMA, you can give her any drug. That same way, if a young man who is 25, 30 is coming to your hospital with hypertension, there are some drugs you cannot give to them. Like that man, in your adamant, it's not the first line of action. Why? Because some of those ogu BP can cause erectile dysfunction. Okay, maybe the man, he might not be able to perform well as a man. The thinking of that thing can give him another blood pressure. So the blood pressure, so that young man might come and say, Obarore for doctor, mpam we BP, no go doctor Nederi Amba, Owero take the sachet, go to the chemist, and they will give him the same drug. Do you know the irony of the whole thing? That drug will still cure his BP, no doubt. But when the side effect of that particular drug comes around, he will not remember because the father didn't have the side effect. So he will think it's a good drug. Since it worked for my father, it will work for me. It doesn't work that way. In that same way, the particular drug you will write for a 25-year-old man, the father that will because of atherosclerosis or what, it will not work for the father. Does it mean it's not a good drug? It's a good drug. Is it good for everybody? No. But it's good for some selected group of people. When they go hang wire or they have manam, when they go hang wire or man they have manam. When we are looking at a person who is 3 months in the first trimester, there are some drugs we will write for you at that time because the drug does not affect certain things. There are some drugs we cannot write for you at that time. Close to the time of ending, because that first time is what we call age of organogenesis. Most organs are being formed. After that time, there are some drugs you can take in second trimester which cannot be taken in third trimester. Because in third trimester, we are preparing the baby to come out from the womb and come and face life. Any drug that will affect closure of the heart and all whatnot, we will try to avoid it. In as long as we might give somebody diclofenac, if there is need, it's not like a common drug, but we can give diclofenac in second trimester. We will not give it in third trimester, especially 1 week, 2 weeks to the time of delivery. We will not give it. Now, a woman might come to the hospital, and we pain, we one or two things. You go and write diclofenac for her. Because at that time, you felt that the advantage outweigh the possible disadvantage. At that second trimester, she will have the drug, she will take it, the pain will go, she will keep it. Close to the time of the delivery, she will have similar pain. She will go and take that same drug. But that drug was good for her in second trimester. But that same drug was no longer good in third trimester. It is the same doctor that wrote it. It is the same individual which it was written for. But the truth is that the timing of the taking is actually wrong. So in that same time, even though the doctor wrote this particular drug for this particular person, as long as pregnancy is concerned, there are some you will take in first trimester, which you cannot take in third trimester. So it's not like, hey, this drug should last for 2 weeks. After 2 weeks, it is good. You will come back. Or you make inquiry, is this thing done? Is this thing done? You take for 5-6 days. In the mega, now you drop it. 2 months later, that thing come back again. You say, no, one doctor didn't wear me. It is the same drug that was given to you, but the truth is that at that particular time, it is no longer good. You understand what I'm saying? So, medicine is not just like try and lock 1 plus 1. Everywhere in medicine, 1 plus 1 and 1. There is a place you do 1 plus 1 in medicine, you will get 11. No, it's not just like that. So, we've talked about the condition. By the time you are coming to the hospital, you don't come sheepishly.